Thank you, Alex. The Hearing Loss Association of America makes hearing health a priority, and it empowers people with hearing loss or those at risk for hearing loss by providing reliable information and support to take action and to live well with hearing loss. We advocate on behalf of all 48 million people in the United States with any degree of hearing loss, and we offer a community of support that all of you are welcome to join. Our hearing is how we relate to the world around us. Hearing should be protected from noise, screened for, and treated if there's an issue. And waiting to treat a hearing loss until it gets worse should not be an option. So you've tuned in today, so we know that you're thinking about your hearing health or you're thinking about someone you know. But many people don't realize that hearing is an important part of overall health and wellness. And remember, there's no such thing as a small hearing loss. If it gives you trouble or your family tells you that it's giving you trouble and it's an issue, take action. Last year, the FDA opened a new category of over-the-counter hearing aids. This is in addition to prescription hearing aids that you get through an audiologist or a hearing aid specialist. Over-the-counter is another pathway to care that gives some people choices. Now, there's not one size fits all to hearing care. You could still see a hearing healthcare professional and get an OTC product. Some people don't have access to a hearing healthcare professional, or they don't have time to seek one, or they don't have insurance coverage. So this is just another option for some people. But an important fact about OTC hearing aids is they are only for adults with self-perceived mild to moderate hearing loss. So whatever route you choose, we hope it leads you to taking that first step sooner rather than later and placing your hearing health up there with your other health concerns. There's been a lot of news coverage and talk about these over-the-counter hearing aids and their new products, and many of us are understandably a little bit confused. And that's why we're here today. This is the first in a series of 4 webinars on over-the-counter hearing aids supported by a grant from the CTA Foundation to get information out to the general public and help answer some of your questions. Now, not all the topics surrounding OTC hearing aids will be covered today, and not all your questions will be answered today. And HLA does not provide assessments or ratings of products, specific products that are on the market. However, from today through next spring in these webinars, we'll present a range of perspectives from hearing health professionals and manufacturers to give you solid information. In addition to this webinar series, we have HLAA's online resources on OTC hearing aids, including a tip sheet, a shopping guide, article links, and a survey. Please complete the survey at some point, share it with others, because it will help us learn more about the attitudes, the use of OTC products, and the understanding of these products. And it helps us provide information in the future that you need. I'm very happy to have 3 panelists here today from the United States Food and Drug Administration with us to help answer some of your questions and have a discussion about OTC hearing aids. First, we have Dr. Nandu Nandkumar. He's the FDA's Division Director for Dental and Ear, Nose, and Throat Devices. Welcome, Nandu.
Hi. Good afternoon. Are we introducing ourselves?
Just say a few words about yourself, okay. Nandu.
Yeah, so sounds good. Yeah, my name is Nandu Nandkumar, and I'm the Division Director for the division responsible for dental and ENT devices in the Center for Devices and Radiological Health of the FDA. My background and experience is in engineering with a Ph.D. in digital signal and speech processing. I have been at the FDA for about 20 years. Our division, among many other devices, is responsible for medical devices that help with various degrees of hearing loss, including wearable devices and implantables. The mission of our center is to protect and promote public health, and we assure that patients have timely and continued access to safe, effective, and high-quality medical devices. In that spirit, our team helped finalize the OTC hearing aid regulations, as you heard, over a little bit over a year ago. This is, I just wanted everyone to keep in mind that this is a new device category, and though the regulations are finalized, the devices that you're seeing are about a year old, and we'll do our best of our ability here to answer all your questions.
Thank you, Nandu. Really appreciate that. And that's great background for people. We also have Dr. Lindsay DeVries, who's an audiology reviewer with the FDA. Welcome, Lindsay.
Hello, can you hear me okay?
We can.
Great. So yeah, I'm Lindsay DeVries. Like you said, I'm a scientific reviewer at the FDA. I am an audiologist. I practiced as a clinician for a while, and I went back for my Ph.D. And most of my research area was in cochlear implants and speech perception. But I did a postdoc here at the University of Maryland looking more at older adults and cognition and hearing loss. And then I made my way to the FDA onto the ENT team. So I do review medical devices, hearing devices, but I did work with the team on the finalization of the OTC hearing aid rule as well.
Thank you, Lindsay. And we have Dr. Julie Cohen. She's an audiologist and scientific reviewer with the FDA. Welcome, Julie.
Hi, good afternoon. Thank you for having us. I'm also, just like Lindsay, we're sort of a pair at the FDA, a scientific reviewer and audiologist. I got my start as a research audiologist at Walter Reed National Military Medical Center, providing audiologic services to active duty and military and veterans, which included hearing aid fittings, and conducting research where the big picture of this research was how do people hear in noisy environments with hearing aids. And so that began my interest in this. And since that time, I have returned and earned a Ph.D. in hearing and speech sciences, and now have the pleasure of working at the FDA, where I work on this incredible team and primarily focus on over-the-counter hearing aids. And this includes reviewing pre-market submissions, and as well as working on communications to the public, consumers, industry, and so on, and participating in great events such as this. And so I look forward to a great discussion.
Thank you, Julie. And thank you all. As you can see, audience out there, we have a panel here with really a deep and rich background and skill set. And now they brought their talents. They're at the FDA and they're here today. Now, we've had a few questions submitted ahead of time that I'd like to pitch to you. And of course, the audience is welcome to submit their questions as well. The first question, I think the most common one is people, these are for adults with mild to moderate hearing loss. It is self-perceived, something they haven't been tested for. Can one of you answer, how does someone know if they have a mild to moderate hearing loss?
Yeah, I'm going to step in and take that. So again, we do want to clarify that with over-the-counter hearing aids, the key word is perceived, because individuals are, deciding whether they perceive that they have this hearing loss. They're not necessarily going and seeing a provider first, a hearing healthcare provider who is performing an audiologic assessment on them. And so on our website, we do, and on the labeling of over-the-counter hearing aids, we have a list of symptoms that suggest what might include a mild to moderate hearing loss. And so this would be, this is on the outside of the box labeling for over-the-counter hearing aids. So something like you have trouble hearing speech in noisy places, you find it hard to follow speech in groups, you have trouble hearing on the phone, listening makes you tired, and you need to turn up the volume on the TV or the radio, and other people complain that either you talk too loud or the TV is on too loud. And I'm sure many people here would feel like that others have made that complaint about them, or they have made that complaint about someone else. And so additionally, I want to bring up that we also, there was also an indication that there's advice as to when you should seek a healthcare services. So beyond just perceiving whether you have some hearing loss, mild to moderate, if you feel that you can't hear speech even when the room is quiet, and that you're not hearing loud sounds very well, these are instances that might indicate you need additional help and that you should probably go see a hearing healthcare provider. And so if you're having difficulty deciding whether you fall into any of these categories or assessing your own hearing difficulty, again, this would be an instance to visit a hearing healthcare provider like an audiologist, an ENT, or even starting a discussion with your primary care. And again, like what I mentioned, these different things such as the symptoms I mentioned, they appear on the outside the box labeling of over-the-counter hearing aids. And so you can actually visually see this information when you go to purchase one, if it's in a retail store. And additionally, this information can be found on our consumer website, as well as linked out to many other websites, including HLAAs.
Thank you, Julie. Also, we've had people tell us, they feel with this self-perceived hearing loss that they might not need a hearing aid 7 days a week, 8 hours a day, but they need some situational hearing, like maybe at a meeting at work. So perhaps an over-the-counter product might be for those type of people, taking that first step who are not quite there, who needs a hearing aid, 7 days a week. Another question that we get, and I think I'll pitch this one to Nandu, but Nandu, if you want to pitch it to your colleagues, that's fine. Some of these devices are found online, and we've seen different terminology. It says this device is FDA certified, or it says it's FDA registered or FDA approved. Do these terms mean anything? And is there a term that people should look for? Could you fill us in about that? Because that gets very confusing to us.
Yes, thank you for that, Barbara. I think we elaborated a little bit on this on our website, on FDA website, consumer facing for the OTC hearing aids. But typically, FDA certified, FDA's registered, or even putting an FDA logo may be a bit misleading. Because we don't certify. Yes, devices are registered with the FDA, but that just implies all medical devices are registered with the FDA. It doesn't imply any special status to hearing aids or any of that sort. FDA approved, of course, has a meaning. We approve the highest risk devices through a process called the pre-market approval, or PMA, and hearing aids are not in that high risk category. Devices such as cochlear implants, for example, are, and so therefore they are approved through a PMA process. There is also a terminology which is known as FDA cleared, and those are for devices that are of moderate risk, class 2, which require a submission to the FDA called the 510K. And so we perform a pre-market review and find the submitted device as safe and as effective as a legally marketed device. And that process is known, once the device goes through that process, is known as FDA cleared. So these are, for example, for OTC hearing aids, the self-fitting hearing aids are the ones that come through the 510K process and reviewed by us, so they can claim that those as FDA cleared. So other than that, really what we required in labeling outside the box is the word OTC and hearing aids. So that's really what would signify that OTC hearing aid complies with FDA regulations, and that's what we should be looking for, the words OTC hearing aids.
So 2 things to clarify, Nandu, that was helpful. There's really no FDA good seal, housekeeping seal of approval.
No, we do not certify, or there is no logo or seal of approval. You're right.
Also, you mentioned that those devices, and I assume the devices over-the-counter hearing aids that have been through this 510K process, they're self-fitting.
Yes.
What does that mean, self-fitting, as opposed to those OTC hearing aids that are not self-fitting?
So yes, that's a really good question. So we under the OTC hearing aid category, we had we have what we call classification regulations, and we had the legacy hearing aids, which are non-wireless, and those are continue to remain under what we call the class 1, and they're exempt from a pre-market review. There's another category called the wireless hearing aids, and if these are OTC, most likely they come with preset controls and some volume, perhaps volume and adjustable volume settings and so on. So these would be also exempt from pre-market review. So whereas self-fitting, that in that category, what we would put what we consider a hearing, an OTC hearing aid that has interactions back and forth with the patient, with the user, through an app, typically through an app on a smartphone, where you are personalizing, if you want to call that also programming or fitting that hearing aid. And that's where the word self-fitting comes from, whereas where the user is fitting that hearing aid to their and personalizing it to their own hearing loss. So that's what we would put it under the self-fitting category, hearing aid category, and those are class 2 and go through a 510K review.
Nandu, thank you. If I'm a shopper, I think it would be really important to read that box. And
Yes.
if it needs a smartphone, first of all, you have to have one. Most people do, but some older people don't. And you have to be comfortable using the smartphone, which, Lindsay, brings me to the next question. Are these over-the-counter hearing aids? What are they going to look like? Do they look like traditional hearing aids that we would picture behind the ear or in the ear? Or how would we recognize one? What are they going to look like? Oh, you're on mute. There you go.
I missed my mute button. I guess the answer is it depends. I mean, you're probably going to see a lot of the popular receiver in the canal style hearing aids, where you have a piece that goes on the back of your ear and a small wire that comes down, and you have different size, what we call domes, little earpieces that go into your ear. There might be some that go further into the ear, but we have to keep in mind those aren't custom hearing aids. It's not like going in and getting an ear mold taken and having it sent off. So we could see all different types. You should be able to see on the outside of the box what type you're looking at, what shape. And I mean, that's just a guess on my part. I mean, we've kind of seen some here and there, but I think it should range the gamut for the most part, with the exception that we have to remember that they're not going to be custom.
Right. And I would imagine, like any technology, this is really a brand new market that we're going to see it evolve in the years to come. And, what's going to be there will be out there. Meredith is here. She's on our staff. And when Meredith shows up, that means we have a question from the audience. Meredith.
Yes, we're getting lots of questions. We can't answer them all, but we'll throw some in here and there. Some we're answering in the chat or in the Q&A, I should say. One that's come up is, are OTC hearing aid companies required to allow a trial period when the device can be returned for a full refund? I know that's something that's come up from a lot of people.
That's a great question. Oh, sorry, Lindsay actually went.
I'll take it.
Yeah, you take it.
So that is a really, really good question. On the outside labeling, so per our regulations, so this is something that the manufacturers have to do, or should be doing, is to show their return policy clearly and contact information with that, so that if someone does want to return their hearing aid, they have a way to get a hold of the manufacturer, they have a way to find instructions. We don't mandate a particular period, but they do need to show what that period is on the outside of the package. So before you're buying it, you have an idea, what you're getting into, whether you have 30 days, 60 days, whatever it is.
And Julie, why is return policy important for people?
Oh, I mean, I think it gets to the heart of the consumer choice. And prescription hearing aids have all had a return and trial period, and it's not specified exactly how long that is. You know, it's usually state by state, the duration, but it again gives the individual a chance to try the hearing aid, determine if it is they find it beneficial, if it's appropriate for them, and have a dialogue with their provider, their audiologist, or hearing aid dispenser about it, and make the choice, which is really where the great thing about OTC hearing aids is it's giving more access and hopefully more choice to the consumer. And so that's why it's great to have that trial period.
And Julie, could you talk to adjusting to a hearing aid? It's not something you just put in your ear and it's going to correct your hearing. Like when we put on our pair of glasses, they correct our glasses. Why is that so? And why should people hang in there and try?
Right. You know, some people, it depends. Some people take to it quicker than others. There is literature in the field about an adaptation period to hearing aids where, you know, you may not have been listening to sounds at an appropriate volume. You may have had hearing loss for many, many years. Sometimes people will go up to maybe even 10 years prior to getting that initial hearing test and making that leap into pursuing amplification and getting a hearing aid. And so that jump from having hearing loss to appropriate amplification, where you're having appropriate volume at the sounds that you're not hearing quite right, it can be a little jarring and unsettling. And it might sound, people will say it sounds tinny, or there's a really loud sound in my kitchen, and then they'll learn that their refrigerator has made a noise for 5 years that they were unaware of, and they find it disturbing. And so those things take time. Our brain kind of becomes on high alert. It's all new, it's novel, and it can take a few weeks to get used to it. Some people, it's very quick. It's beneficial and they love it right off the bat. Others, it can take 2 or 3 weeks and maybe even longer to really settle in. And so that's why it's so important.
And you mentioned there that some people take 10 years to get hearing help. And we've heard things like maybe it takes 5 years from the time they get a diagnosis to the time they seek treatment. So maybe we're hoping with over-the-counter products that people might take that first step into getting used to some amplification, you know, not waiting till it gets worse and so bad that they've waited 10 years to have that stimulation. So thank you for that, Julie. Looks like Meredith, we have another question.
Yeah, lots of questions about Bluetooth and telecoil options. Is this available in an OTC hearing aid that you all know of, or in some OTCs? And is it required to be stated on the box that there is telecoil or Bluetooth if that's available?
And also that begs the question of what features could people expect, Bluetooth, telecoil, or other things? Whichever one of you want to answer that, go ahead.
I can start, and
Okay.
Julie, Lindsay, jump in. So I think when we were writing the OTC hearing aid regulations, our task was to provide this balance between assurance of safety and effectiveness and promoting device innovation, device development. You know, so we didn't want to be too prescriptive about technology, and as you said, Barbara, earlier, that this technology will evolve and it is going to change. But we did provide some basic labeling requirements where I think these, whether the device has Bluetooth or telecoil, whether we need to use a smartphone in order to use that device, those should be, and if they're complying with the OTC hearing aid regulations, should be displayed on the box. What is needed, and I would encourage everyone who buys an OTC hearing aid, as we heard from this previous conversation, to read outside the box what the return period is, so that you can, if something doesn't work out for you either from a technological or a features perspective, or the adaptation perspective that Julie mentioned, either way, you at least have that option to return it, so that and find one that suits you. So yes, so as technology evolves and as the features that are needed for a hearing aid, OTC hearing aid may have it likely will have Bluetooth. It may have other types of technological features that make it easy for you to use and stream audio and program your device. Yes.
Nandu, what if I'm shopping online and I can't get a hold of that box? How am I going to read the box?
Yes. So no, that's a really good question. So I think it's really key to know that and we mandated that this labeling, outside the box labeling, should be visible to the user prior to buying. So one way to, if you do not have access to it, I would say, I mean, online retailers should be displaying the box on their contents of the box. It's not very hard to take to pictorial representations of the outside of the box. If they're not there, I would ask to see it before buying.
Mm-hmm. Good advice. Lindsay or Julie, would you like to jump in with anything here?
I feel like Nandu kind of covered everything I was thinking. I do think it's important to remember, I think Nandu already said this, that, features will evolve and change over time. Your needs might evolve and change over time. So it's something that the features that come with these hearing aids by and large might be relatively similar, like noise reduction or whatever it is. But it's going to be up to you as to whether it works for you in the sense that it's giving you the benefit that you're looking for. So it's just like Nandu said, it's something you might have to take out on the road. And then if it doesn't work for you, you can take it back.
And if you do take it back, should you try another device? What should you do from an audiologist perspective?
I mean, if you're highly motivated, I don't see why not. If you feel like financially that's reasonable for you, I don't see why not. I can't tell you how to make that decision, how to try one over the other. But that's kind of the beauty of this situation, is that you have, like Julie said, you have consumer choice, you have vendor choice. You can look online, you can go to different stores, and just sort of, decide what works for you and what doesn't work. And it just leaves you kind of an open forum to decide whether it's going to work for you or not.
Meredith, another question?
Yep. Here's one. How is the FDA addressing hearables, things like earbuds and other products that are being used by some individuals as hearing aids, but they're really not marketed as hearing devices?
I can start. So, I don't want to get hung up in names like hearables, wearables, all of these. I'm not totally sure. Sometimes people will use them to mean multiple types of products. At FDA, what we've been looking at is personal sound amplifiers or hearing aids, right? I mean, that we have a guidance that points to whether something is when something is a personal sound amplifier versus when something is a hearing aid. It's in the intended use of the device. We acknowledge that in many cases, there may be some overlap in technology between these personal sound amplifiers, or if you want to call them hearables, and hearing aids. And again, as we all know, earbuds or headphones, earphones, whatever you want to call them, also have microphones these days. So there are ways to use them as personal sound amplifiers if there is amplification involved in that, when they provide you that. So it's really, the difference is in the intended use. Over-the-counter hearing aids and prescription hearing aids, the intended use is to compensate for hearing loss. And for personal sound amplifiers, the intended use is to provide you with provide a normal hearing person with enhanced hearing in certain situations, such as bird watching or hunting, and etc. So that's where.
So Nandu, so a personal sound amplification product, sometimes are called PSAP. So those will never have the word OTC hearing aid on it. Is that correct?
They should not. Yep.
Okay.
If they have the word OTC hearing aid on it, they should be complying with the OTC hearing aid regulations, and they should be registering and listing, or if not, they would be a self-fitting hearing aid. One of those things. They should not be marketing themselves as hearing aids. Yes.
I see. Good clarification. Meredith.
Yeah, can you all recap, because we're getting some questions about this too, just a little, again, I know you said some of this, but again, recap a couple of things that people really should be looking for on that box. It sounds like one of the things is that it actually is an OTC hearing aid, not something else, correct? And then maybe a couple of the things that a consumer should be looking for.
I can take some of this, Julie. Feel free to hop in if you want to. I'm just going to go from the top of my head, but there on the outside labeling, it's kind of your, I don't know, for lack of a better word, your main guide, your kind of Bible. Before you buy the hearing aid, it should have information as to whether you think you have a perceived mild to moderate hearing loss, like Julie talked about. Situations in which you might want to go see a healthcare professional before you buy the hearing aid. There are red flag conditions on there, so professional before you move forward, like dizziness or pain in your ear, excessive earwax. There's a whole list. The return policy should be there, contact information, and like Nandu said, it should clearly state that these are hearing aids. If the box says hearing aids and these items aren't on there, then they're not compliant with the regulation. There should also be information on there to clarify that these should be used for people only 18 or older. So this shouldn't be used by children or people under 18. Someone jump in if I'm forgetting something, but there is a lot of information on the outside labeling. So you might have to stand there for a few minutes in the store and kind of read through it, but I highly recommend that you do. It's not that you can't return it if you take it home and open it up, but if there's something there that's not speaking to you, or you think you need to see a medical professional, you can save yourself a little hassle by looking at the front of the box or around the box. Yeah, I think I've got the major ones. I'm not 100% sure.
Yeah, the only other major one I would say is it should provide information about the battery that you're required. And again, all of the outside the box labeling, we did do screen grabs, and it is on our FDA consumer page. So you don't have to sift through the final rule, which is a little bit meaty. You can find it on our page.
Here's one. Can someone buy an OTC hearing aid and take it to an audiologist for programming?
Probably yes. That was a proposed model for using OTC hearing aids. I can't speak specifics as to who uses that in their practice, but yes, someone could take their OTC hearing aid to an audiologist that was willing to do it. They might advertise, "We will help you with your OTC hearing aids." Actually, now that I think about it, I have seen a practice. So it is a model that is used. So yes, you just have to, contact an audiologist and see if that's something that they are willing to provide. It may not be at every location, granted, but it is a possibility.
And it would typically be a fee for service.
Absolutely. Yes. It would be a fee for service.
Mm-hmm. Mm-hmm.
Or whatever's worked out there. Yeah.
Right. So again, remember, we have OTC hearing aids and traditional prescription hearing aids. And this just opens up another pathway, and it doesn't have to be an either or, like the person just asked. Could they have an OTC and get help from a hearing healthcare professional? Absolutely.
Here's a question. How is the FDA enforcing the OTC rules?
Okay, well, Nandu is probably.
I can jump in on that. Yeah, I mean, it's the same as enforcing all of the medical devices. We have a adverse event reporting mechanism. We have that on our website, including the hearing aid website. So we monitor reports coming in. we have voluntary compliance requirements on recalls and such, which we then process. We also investigate allegations. There is a link, I think, in our website for submitting allegations, and we investigate those allegations. And so yeah, it's a variety of ways. Post-market monitoring, post-market compliance, and investigation of allegations, and also by routine inspections and of medical device manufacturers. So there are the variety of ways that we kind of get to know what is going on in the marketplace and monitor these devices.
And the marketplace is so new, Nandu.
Yes.
People ask, where do you buy these devices?
Yeah, I guess we would have the same information that you have, Barbara, at this point, that it is that that there are more and more, what I see are brick and mortar stores that might be coming in with shelves stocked with OTC hearing aids, but it is likely a process that is ongoing. So and also on online retailers. These are, I think, or in some cases directly from the manufacturers. So there's a variety of ways right now that you can have access.
Panel, you might not know the answer to this, but if somebody buys an over-the-counter product, say in a pharmacy, what are the chances that if they showed this to the pharmacist, could the pharmacist answer any questions about it? Or we don't know. The market's so new, right?
It's hard to say. There are programs out there that, are interested in developing an interaction between OTC hearing aids and pharmacists and providing education to pharmacists to be able to assist. But it's, it's not clear, if this is in every pharmacy yet. And again, this is still so new, but that is a hope and a possibility.
It's great. And that's why we do encourage you all to take our survey, because the more information we have about what people are seeing, and if you're buying and if you're looking and what your attitudes are, then we can just get you more webinars, more resources, more information. Okay, so what haven't we covered, panel, that you want to know about, or that people want to know about, that you think we missed? Meredith, there must be another question since you popped up.
There definitely are. Okay, can you all talk, I know we're not talking about specific products, but can you talk about the price points and maybe the range in pricing for OTC, and how do you see this changing or playing out as the market evolves?
I think that might be a little loaded question for us, but typically we don't get into the pricing and the cost. But I mean, but we should say that the goal of OTC hearing aids was to have more access and more, and I think affordability was part of that of that equation, I think, when we developed our rules. But it's not like we don't take into account the cost when we finalize and develop our regulations, but the hope is that providing that over-the-counter access and providing various ways for consumers to have access to and use hearing aids for the market has to kind of develop, and the price points will adjust themselves as people use and buy, and more features and different technology, and the costs of that providing that technology go down. Hopefully there will be more options for affordable hearing aids.
Yeah. Sorry, just to very quickly piggyback on that. That being said, there is a basic level of performance that should be assured of these devices. So, even if these are not self-fitting hearing aids that we're reviewing as a team, the OTC hearing aids out there should be adhering to a basic level of performance that should ensure kind of under the hood the things that we probably shouldn't dig into kind of in the weeds stuff, but there is kind of a minimum standard. Even if it's a cheaper device, it should meet that minimum standard.
Right, which the
And-
FDA set those standards.
Yes, in the rule. Yeah.
Mhm.
Oh, and I do want to also chime in about the pricing, that it is a little bit of a different pricing model when you think about it, because with prescription hearing aids, the price can sometimes bundle in other services from the audiologist, such as the hearing evaluation or additional visits to the audiologist for the year, things like that. That can sometimes get bundled into the cost of the hearing aid versus an OTC hearing aid. You are in many respects, depending on the device, you may just be paying for the device. So it might be a little bit different for that model.
I'd like to ask Nandu, of course, many people out there, is what prompted and inspired the opening of the new category of hearing aids? I know it just wasn't the three of you sitting at the FDA saying, let's the three of us do this. What inspired this opening of this new category?
That's a great question. I mean, it's been, we've been, I think I remember many years ago, NIH at DCD, National Institute for Deafness and Other Communication Disorders, had a workshop on affordability and accessibility in hearing aids. And so the discussions have been going on for a long time now on, what the model that we had before this, today's model of prescription versus OTC hearing aids was hearing aids were what was known as restricted devices, where you had the ones where you had to go and sign a medical evaluation waiver and obtain hearing aids through an audiologist or a hearing healthcare provider, a dispenser, or you could also get, direct to consumer type hearing aids. But there wasn't in some states, not all states. So there wasn't a category where you could get over-the-counter hearing aids all over the country, all over the US, right? There wasn't one rule that preempted all the state rules and had that. So that discussion had been ongoing. There was a report from the Presidential Council of Advisors on Science and Technology, PCAST. I don't know how many years ago was that, 7 or 8 years ago. And that was followed by a report by the National NASM, which used to be called I forgot the old name.
Institute
National
of Medicine.
Institute of Medicine, but now called the National Academy of Sciences and Engineering and Medicine. So that report, and so that was followed by, and those reports tasked the FDA and the hearing healthcare stakeholders to basically do something about this, the issue of access and affordability of hearing aids, so that there could be a United States wide rule that could be applied everywhere and not just in some states. So, and then after that, Congress passed a law in
2017.
2017, correct? And and after that, it tasked the FDA with developing the regulations for these over-the-counter hearing aids, where they gave us the authority to do that and preempted all the state rules for this over-the-counter hearing aid. So that's where it all started. And then we took our time for the rulemaking, and where we engaged with, over the years, I know there is that it took us a little bit of time to finalize those rules. But as most of you know, the FDA rulemaking takes a little time. We engaged with many of our stakeholders and developed these rules, went through a comment and addressing the comment process, and finalized the rules, published the proposed rule, and then the final rule. So that whole process and was a year ago, October, when we published the final rule, and here we are today. So
Thank you for that overview. Public policy certainly takes a long time, doesn't it?
Yes, but we are here finally. So
We are here.
that
I have another question. Is there somewhere that consumers can go for relief if they feel that they've been sold something that was not right or it's not working? Is there something that should they turn to the FDA, and what can they do?
So yeah, FDA does have an allegations website. I think they also have a phone number as well that you can call if you have an issue. Additionally, I believe Better Business Bureau is another option that you can contact as well. So we do track that. So those are some choices. You can also contact the manufacturer itself to reach out to them if you were concerned about a particular product. I'm not sure if anyone else has any other suggestions, but I can also send it. I think on our website, on our consumer OTC page, we do have a link to the allegations website, and encourage you, if you see something or practice in purchase, or you received something that was not right and feel that it wasn't handled correctly, you can file that with our allegations.
Excellent. I have one more question here about instructions on OTC hearing aids, and if they're going to be just amplifiers, or if they're really more sophisticated than that, the OTC products.
The answer is yes. It depends on the price point, the manufacturer, just, any number of things. It can go anywhere from something very, very basic, like Nandu was saying earlier, volume control, to, et cetera, some kind of presets, all the way up to self-fitting. So you will see things run the gamut. But I mean,
and Lindsay, as you also mentioned, I mean, it'll be, I think, probably selling it short to call it just an amplifier, right? I mean, it's like we have
very good point.
we have performance requirements, as Lindsay said, for electroacoustic performance, the distortion, the noise, and we have certain minimum specifications that they need to meet, and these OTC hearing aids, even the most basic ones, will have to meet them. Not let alone the self-fitting hearing aids. Those have a lot more features in them, such as software and application interfaces and so on. But even the most basic over-the-counter hearing aids would have to meet a certain level of performance and quality, and these are still subject to good manufacturing practices. So each device would have a certain expectation. You should be expecting an expectation of quality, systems quality, that it has been manufactured to.
And if
the fidelity of the hearing aid as well. I know that Nandu was mentioning the distortion, but also the fidelity is really important of the response of that hearing aid. So indicating that it is not just an amplifier.
Right. And if, as we've been kind of alluding to this whole time, if you're someone that you get something that's very poor quality, or you like kind of looking through all the tech specs and you see something that's off, that doesn't look quite right, that is definitely a time to submit an allegation, submit a complaint, and that's certainly something we could look into. So we are looking at we're willing to investigate all these OTC hearing aids on the post-market side. We're not just reviewing this very slim category.
I know that we've covered this a couple times, but it might be good to revisit how it might work in terms of getting a hearing test from a professional. Like it could be a hybrid model. It's not just strictly over the counter and you never see a hearing care professional, or strictly with an audiologist, how there might be a hybrid kind of model. A lot of people are asking, doesn't somebody need a professional hearing test first, so they know for a fact that they have mild to moderate hearing loss? I know we've answered this question in the media a lot, but if you all could address that.
Yeah, I feel free to jump in, colleagues, but I was thinking about this earlier, actually, because we kind of addressed it the other way. If you get a hearing aid, can you go in and get it programmed by the audiologist? like Julie was talking about, the rule is written, the law and the rule are written for perceived mild to moderate hearing loss. So the idea is that you're walking around Walmart or somewhere and you want to go look at the hearing aids and you're not sure what your hearing status is. There is kind of a way for you to look at that outside labeling and make a judgment for yourself, kind of self-select yourself as a potential candidate for these devices. And there's a whole list of kind of bullet pointed communication situations you can go through. That being said, you of course have the right to go to an audiologist and get a hearing test. PSA, Medicare, when you turn 65, you can get a hearing test a year, unless that's changed since I left the clinic. So you absolutely can do that. And you can look at that hearing test and talk to your audiologist, and you can get, you can go the prescription model, or you can try to go out and try the over-the-counter model. If you hate one or the other, you can do the other. The whole idea is to lower the barrier of entry, but that doesn't mean you can't get more information on your hearing.
Excellent, really good information. What should people do if they need help in one ear versus another? Do you think that OTC is something that a person that needs help in one ear may find help with?
That's a really good question. And so technically, it is possible to do this. However, so the hearing aids that we are seeing, the self-fitting hearing aids, all the studies that are being conducted are for individuals with bilateral or sort of the same hearing loss in both ears. But with having hearing loss in a single ear, we want to, rule out first that there isn't sort of a medical reason why something is going on in one ear versus another. So you would want to go and first check, is there, to go see your either audiologist, ENT, healthcare provider to determine why you have this asymmetric loss. And so once that has been evaluated and your provider deems, okay, you are okay for hearing aids, we've ruled out any additional medical concerns, then you could potentially benefit from an OTC hearing aid in that ear if it is, a perceived mild to moderate hearing loss. However, to my knowledge, many OTC hearing aids are boxed as a pair, so you would have to find something that is maybe boxed single. So, but again, as we talked about previously, or I think Lindsay mentioned that a red flag condition includes the asymmetric hearing loss. And so again, we first want you to go and be evaluated by your medical provider to determine what is going on with that hearing loss, if there is any sort of solution that needs to be addressed first. And once you are cleared, then you may consider those options.
Julie, that's so
that
important.
Includes licensed physician,
Right.
preferably ENT, otolaryngologist.
And that's so important. If you wake up one morning with a sudden hearing loss, you would not run to buy an over-the-counter product. You would see a physician.
Yes.
We've come to the end of our time. So before we turn it back to Meredith and I have to sign off and you all have to sign off, I want to thank our colleagues at the FDA. You have been terrific. You've answered so many questions. The time has gone so fast. And I want to thank you, and I hope we'll see you again. And Meredith, I'm going to turn this over to you. There's some wrap-up information. So thank you, everyone.
Absolutely. Thank you so much, panelists. Thank you to all our participants. We had a record number of participants today. Thank you to our live captioner, Lisa Johnson, and thank you for joining us for HLAA's OTC 101 Ask the Expert webinar. This is just the first in, there'll be 3 more in this series, so stay tuned for information. All of the resources we shared today are available at www.hearingloss.org/OTC. Please take a minute and take our survey about over-the-counter hearing aids, because it really helps us gauge knowledge and interest. You'll also be getting a follow-up informational email with an opportunity to share feedback about the website or about the webinar. Thank you so much. And Please stay tuned for HLAA's next Hearing You webinar, which is coming up about disability inclusion in the workplace. Make sure you get your spot for that one soon. Thank you again for supporting HLAA and hearing health.